Hi, I'm Dr. Rajani, and today I've been asked to talk about 3 tips for Sculptra. A lot of people are intrigued by injecting Sculptra, and you find those who inject it love it and tend to inject a lot, and then other people don't use the product. And so what's your kind of 3 tips on being successful at using Sculptra and setting people up for success? So that's what we're going to talk about today. I thought about this for quite a while, and the first thing I think is important is to prepare your Sculptra correctly. Part of the problem was when it was first introduced for HIV lipoatrophy in the United States in 2004, what's on the label and how we were taught to inject it and even to mix up the product isn't how we do it today, and that's part of the problem and the confusion. But that can be a benefit for those who learn how to do it. It's a great product and it provides benefits that fillers or regular products don't. So the first thing is to prepare it properly. And I always say to not prepare is to prepare to fail. And with Sculptra, I tell people a minimum of 24 hours before using it. Now, some people do 5 or 8 or 12 hours. I like 24 hours. You should always have Sculptra on hand to inject. If you have it, you'll use it. That's just the nature of it. Almost everyone is a Sculptra candidate. So what do we use? We use sterile water with preservative. And a lot of people then ask the question, well, how long will it last? And in my mind, it's up to 30 days. There's no good study on this, but it will last you about 30 days. An important tip to go along with that, don't ram the water in there. Think about these molecules and the PLLA, polyl-lactic acid. We want that to hydrate in the water. And if you put the water in too fast or the vial falls over, you'll have some particles on the side and the top of the vial that aren't saturated. So preparing your Sculptra properly, that's the first step, and having it ready to go. Second, on injection, one of the things you'll notice on my videos is that I do a lot of temples and high cheek. Why? Losing bone makes people look older, and we're recreating beauty. If you notice people who look young into their 60s, 70s, and 80s, they often have a high zygomatic arch, and their temples aren't unusually hollow. So by filling this area, creating collagen stimulation using the product up high, it creates a beautiful natural look. And to use a high hyaluronic acid up in the temple region is very expensive for the patient. They burn it off very quickly, and Sculptra's a great long-term it's a great long-term use for Sculptra, because if you look at the graph on the study, for the approval study, at 2 years, the graph was going strong. They just stopped the study. The product didn't dissipate or reduce in effectiveness at the 2-year mark, but the study was stopped. So it's long-lasting, and placing it on the bone while you're learning helps prevent the dreaded nodules, which in reality, if you follow the new way to use it, are very minimal. But people always are scared about what they read online and about the old Sculptra. We're talking about the new way to do Sculptra. So tip number 1, okay, was to prepare. Tip number 2 is deeper injections on the temple and the high cheek, and you can stop there. The lower face is excellent to treat with Sculptra, but it's a little more advanced techniques. It's a little more teaching on how to look at the skin, and the dilutions can be different. So stick to the upper face. Tip number 3 with Sculptra aesthetic, follow up. This is where many practices fail, because people look amazing when they leave. Why? Because they now have volume that they didn't have for the past 30 years. And now they have that volume and they're excited. But guess what happens at week 2? Disappointment. Because the water goes, remember Sculptra's mixed into water, and to that note, they looked at many different mediums. We were going to make PLLA in hyaluronic acid, but water is the preferred medium. So the water goes away, and you may have put 18 cc's or 2 vials of Sculptra in a person's face. It looks fantastic when they leave. But it's following up at week 2, seeing them back at week 4 to 6, repeating the dose, and then following their response over the next 4 to 14 weeks, and maybe touching it up with a third treatment. That's what gets practices. They have trouble following the patients out that far and then seeing them back and recommending follow-up treatments to get the patient exactly where they want to be. And without fail, it's a very predictable treatment. By 2 to 4 to 6 months, people are seeing amazing results. It's amazingly predictable. But people miss that step of follow-up and adjusting and then changing the concentrations to get the skin exactly where they want it to be. And that's all part of what we teach here at the Aesthetic Training Center. So those are your 3 tips on Sculptra. There's much more on Sculptra. It's an art, but it's an amazing product as you use it. If you have further questions, join us on this YouTube channel, ask below, click like if you've liked the video, join us on Instagram, also on Facebook for continued helpful tips. Keep your skin and body beautiful, healthy, and vibrant.